Thank you very much for joining us. I'm going to switch to Portuguese for the introduction of our conversation, and then we will have the debate, the questions in English, as we have Portuguese and non-Portuguese speakers in our conversation today. So thank you very much for joining us. Obrigado por se terem juntado a nós neste final de dia, naquela que é uma das primeiras iniciativas que levamos a cabo neste novo ano, 2022, no ISCTE, e tenho a honra de vos agradecer a presença e de convidar a professora Luísa Lima, diretora do ISCTE Saúde, a dar as boas-vindas a este ano de atividades, num dia marcado pela aprovação do reforço do empenho da reitoria do ISCTE na área da saúde, mas, professora Luísa, 2 ou 3 palavras para si e para nós todos e para todos os que nos estão a acompanhar e que vão acompanhar esta sessão. Obrigado.
Então, muito bom dia, muito obrigada por estarem connosco, muito obrigada, Henrique, por organizar este debate. O ISCTE Saúde começa da melhor maneira este ano de 2022 e com o lançamento deste novo curso avançado em saúde digital. É uma iniciativa que mostra um bocadinho o que o ISCTE Saúde quer fazer, que é trabalhar com pessoas de diversas disciplinas em áreas fundamentais da saúde hoje em Portugal, e a saúde digital é seguramente um desses temas, e nós vamos ter nesta formação pessoas tanto da área das ciências sociais como da área das ciências tecnológicas, e por isso vamos conseguir ter aqui uma formação verdadeiramente inovadora e diferente e que vai ajudar a melhorar as capacidades dos profissionais do nosso país. Muito obrigada, Henrique, por ter organizado quer este debate, quer esta formação, e estou muito segura de que esta segunda edição da formação vai ser tão boa como a anterior, ou melhor.
Obrigado. Será melhor se tivermos, obviamente, a participação de todos, agradecendo desde já ao corpo docente que viram passar. Eu vou fazer depois uma descrição novamente no final da nossa conversa sobre o curso, mas agora gostava de passar para o nosso debate, e por isso vou passar para inglês. The idea today is to discuss complicated topic, the topic of the interplay, the interrelationship between people, data, and COVID-19. And I labeled it 4.0 era because some people say we are in the 4th wave of COVID, others say it's the 5th wave. Well, it depends how you count the waves. It's like in the sea, you know, if you're a surfer, some people say every 7th wave is bigger than the other waves. But, you know, sometimes people say, I never see the 7th wave because they don't know how to count, or they have not standardized the way they count. And it's actually, that's a good first question, you know, and what is a wave and what is not a wave? But anyway, we also talk about 4.0 as digital technologies that are changing healthcare and other sectors, and we use the expression industry 4.0 to talk about AI, 5G, Internet of Things, and of course we talk about health 4.0. And people are not in the 4th version. People are in millions of versions. There's about 7 billion of versions. I don't know if you know this series of Loki, where the variants is very famous on the channels now from Marvel, the variants. But anyway, this is to bring you to the discussion, and we have 3 people that I consider to be of excellent background, of excellent position to be able to discuss with us today. Ladies first, we still say in Portugal and I guess in Malta, from our southern traditions. Professor Luísa Lima, she's full professor of social psychology at ISCTE School of Social Sciences and Humanities. She has been the president of our ISCTE Scientific Council for a number of years and re-elected with, I think, over 70% of the votes, which is very unusual for a university with social sciences, architecture, business schools, and others. And she's director of ISCTE Health. We have Dr. André Peralta, who is a public health doctor. He is consultant at the Director General for Health and Epidemiology and Information Systems in the Portuguese Public Health Directorate. And he's also finishing and completing his PhD in Washington, Seattle, Washington State in Seattle, and has published many things. He can tell you about them later on, or in LinkedIn if you contact him via LinkedIn. He's very available to help others, and so is Stefan, that is coming from Stefan. I always have a problem with your surname, Buttigieg. But I'm sure you don't mind. And basically, he's coming from Malta. He's part of our program. He's lectured in our program last year. He's co-founder of Digital Health Malta, and is also public health trained. So we have a special panel, and we would like you to put questions both in Portuguese or in English. It's no problem. I can cover them into English and convey it to our panel. So during the conversation, just put the questions on the different on the YouTube channel, so that we have the questions in the middle of the conversation. So we're not going to wait for after they speak to get your questions. Just put your questions over. Anything is a good question. And to start, enough talking of me, a few questions, and I would like to maybe ask Stefan to go first on some of them. You don't have to address all of them, but I mean, some of the questions that I have is, you know, can we use personal data to allow people to be less confined? I mean, could we have done confinement in a different way if we have used personal data? Can we allow full endemic status to be promoted? So some people now are coming out in the news saying, you know what, this stops the pandemic. Let's talk about endemic, and let's just accept the virus is out there and we should go along with our lives. Should societies change regarding human touch and proximity after this? So should we touch less or more? Or should we be closer or far away from each other? And then two final questions to provoke your thoughts and initial reactions. What data forecasting and nowcasting technologies could help us with? And is data being used and reused wisely? Are we using wisdom in the way we are using data about people and people's data? So this is the first set of opening questions, but feel free to comment on the topic broadly. Stefan, tell us first, how is the situation in Malta? So the news report, and then go over to just share your thoughts with us. Thank you so much for joining.
So it's extremely obvious in Malta right now that the transmissible variant of, and increasingly transmissible variant of Omicron has taken hold in Malta. Of course, we're still awaiting more outcomes from the genetic analysis to see the actual percentage, but in reality, because of the fact that we're trying as much as possible to maintain an open society for multiple reasons, including mental health, we are seeing this spread happening in numbers, you know, that they are quite high. But at the same time, when you see the number of tests, we're still looking at a positivity rate in the region of 16%. So some countries are struggling with this, and they're even as high as 50. Because we had such a strong vaccination program, and even though we're dealing with a more transmissible variant of the COVID-19, we're in a situation where, you know, the positivity rate is higher. Yes, it's true, but, you know, it's a bit more controlled. So yes, we have high numbers, and we had to rethink the way we collect data. And we collect data even from the COVID positive patients. So there was a major shift, out of all times, it happened during the Christmas period, where people are seeking a bit of rest. So that was, you know, it was quite challenging for all members of the COVID-19 public health response team in Malta. But taking into consideration everything, and even like reflecting on the situation, I think that we will overcome this. Like looking at the evidence and looking at what's out there, and also looking at the rate of hospitalization in Malta, whereas now we, like, you know, we skipped the 10K mark, and we have approximately in the region of 100 hospitalizations and 5 people in the intensive care unit, whereas before we used to have much less active cases, and we had a similar amount of hospitalizations and ITU. So when you compare both, you say, okay, wow, there is a real difference. Something is going on.
But do you think we could use personal data to save people from staying closed in the house, as we've done in the last 1.5 years? Could we have done it differently?
I think, look, so if you look back, because people talk a lot about precision public health, and if you go look way back, John Snow, you know, one of the very first, you know, public health physicians on the ground, was doing some precision public health. He was collecting the data and then deciding on data. So the more data there is available, then the more precise decisions we can take. But it's useless having all the data available and not having the people or the skills to analyze that data, or even the digital infrastructure. So you might have the best data collecting systems, but then you realize that you don't have the people to actually set up the reports, for example, something as simple as that. So I think that's the next.
Stefan, when you say data, are we talking about, you know, who did you have dinner with, for example? How many minutes were you at dinner table? I mean, what type of, because it seems to me that 1.5 years pass, you know, we are always talking about the same type of data, and yet some people say, you know, it's strange because this person is married with this person and he didn't get it and she got it, and I went to this dinner restaurant and 2 people got it, the other 2 people didn't get it. And I have always a question. In many tables we have, you know, not round table, but people facing face to face. Is it the people that were facing the other person, or is it the people side to side? 1.5 years later, do you think we could not have created models that are a little bit more sophisticated, like asking people about this personal details about their life? Or do you think that they would not participate with that type of data? What's your opinion?
I think that we need to balance things out, okay? So when we ask data, we're asking the people to give up a bit of themselves. You know, we're asking them to give up information. Sometimes it would be information that they might not be willing to share. Something as simple, for example, as people going out, for example, on an extramarital affair. Something as simple like that sometimes. And contact tracing, for example, has exposed a lot of these things happening. So sometimes if you ask people more data, you know, they're giving up a bit of themselves. So we need to give them back something in return. So for the data that they give, we have to definitely give them something in return. And I think that the policies that have evolved, even in Europe, across Europe, haven't as yet given enough value for the data that they give. So I think that unless we resolve that lock that there is between these 2 things happening, it's going to be very challenging to ask people to give more of their data, and even if you look at it, we're not looking at just people giving their data, just by the example you said, but we're even asking restaurants to give up information on their table layouts that they might have been planning for years, for example. because that was what was optimal for them. So there are all these different things, and if even different, you have structured data and unstructured data, and even bringing those together, sometimes it's a major challenge. But I think looking at all the evidence and looking at all there is out there, yes, we can do more, but we can only do more if policy and the relevant skilled human resources are in place to allow us to scale up. Otherwise, we'll stay stuck.
Now, Andre, what's your take on this? I mean, you've been in all sides of the equation throughout the thing. I remember you did a study many years ago on our call center, back in the age when in January we would get nervous with a small rise of calls due to the flu. Together with me, many years ago, we tried to do this prediction algorithm based on emergency room visits for flu. And I know you decided to share some slides as you talk. But before you do that, which would be great, so if you can make sure they're ready for that, I have the question: do you think people really? Let me put the question the other way around. What if we never get rid of this type of viruses, and we really need to have to manage these contacts differently, rather than assuming this will pass in 1 or 2 years? What if the new flus, the next type of viruses is always so threatening that we do need to know the layouts of the tables until we authorize the opening of that restaurant or not, or the layout of the chairs or the ventilation pattern of a gym, rather than just bluntly closing down all the gyms and making people all fat, which happened. I think most of us got 1 or 2 kilos more on average, for sure. Well, except Louisa, she continues to look super healthy and elegant. But anyway, over to you, Andre. What do you think about these provocations?
Thank you, Enrique. It's a wonderful question, and hi to everyone on the other side of the screen. Well, I think historically, this virus will pass. That's kind of one of the main lessons from history. All the pandemics end sooner or later. What I think with the emergence of climate change and other challenges, we will have other epidemics and other pandemics. That will happen sooner or later. And from the past epidemics, we have seen some great scientific advances. For example, it's hard to recall, but the first 10 years ago, the first flu pandemic, the H1N1 in 2009, brought the PCR, and the PCR is now widely available to us, and it was only 10 years ago. And this is a great advance from a past pandemic. And Ebola, for example, was very important to tackling the innovation for new vaccines, the vector vaccines and the mRNA vaccines. And from this pandemic, what I think one of the main things that we will get from this pandemic is genomic surveillance, is one of the great advances from this pandemic, but also forecasting. Forecasting in a way that I think we will, in 10 years maybe, we will see it it was very rough because it's very hard to predict human behavior. And that to tackle your question directly, I think that will probably be one of the areas where we need more research, and machine learning can help a lot, is to predict.
Andrea, let me stop you there. But first, 2 quick reactions to provoke you even further. So we need every time a new pandemic comes, we get happy with new advances, or could we actually be the other way around and have some incredible advances to avoid at least the second wave of the next pandemic? And the second, as follow-up provocation, is: do you really need more AI to predict human behavior? Or, linking up to Louisa's contribution later on, we need to know more about people than we know about viruses, because It seems to me we know a lot about Omicron, but we seem to not know much about what makes people not wear a mask when it's not that hard. Huh? So over to you. More AI or more understanding of human beings? Because those are here to stay, I hope.
I think we probably need both. There's some, I think we have a lot to learn from this pandemic as well in terms of government response. Widely, in a way that I was not expecting, they varied widely. Even in Europe, governments had reactions, they react very differently from having the same threat, the COVID-19 pandemic. So I think we'll also need, when the pandemic stops, to think and to do some research about how can we understand government response. But the other issue, I think there's still a lot of room for improvement when it comes to new technologies to predict human behavior. And I will give you 2 or 3 examples where we failed miserably because the technology was not ripe yet. Digital contract tracing was a huge hype in probably, I think, May, June 2020. And it's a wonderful idea. And one of my predictions is we will do digital contact tracing in 10 years for a ton of infectious diseases. This will be the standard practice for a public health doctor. The technology was not ripe yet. And because we oversold this technology and the technology was not ripe yet, there's fading interest from the scientific community, but also from the public community for this technology. What we need to do again is to put some money and put some bright minds to improve this technology, to make it more accurate, because as it was, I could be, so I have a wall dividing my room and my neighbor's room. I never see my neighbor, but with this technology, it would be a high-risk contact if I got COVID. So we need to fine-tune these technologies. I don't know if I answered all your...
Well, unfortunately, good actually. We have a question already, and it links with what you're saying. So I will already put the question through to you, and of course others can comment later. But before I move on to your slides, Clayton Hamilton from WHO Europe asks this question. So it's been in one of our chats last year. So thank you, Clayton, for participating. And he asks, can we use the data we have, I'm reading it very carefully, to forecast if and when new COVID-19, not for new pandemics, this current pandemic, variants are likely to emerge? Maybe over to you on this one, and then maybe you allow me to jump for Luis, and then we come back to you for some of the slides you wanted to share with us.
That's a wonderful question, and it's very hard to answer correctly. I can share some thoughts, what I think it's reasonable, and from what I have read in some scientific papers. So right now there was a very good paper trying to use machine learning to predict the key mutations that COVID-19 can have that are a gain of function. A gain of function is a mutation that gives a new ability to the virus. And these gain of function mutations are absolutely key to predict the next variant. And actually that paper was a reasonable forecast to tackle which key mutations the virus need to acquire to be more fit to infect other people than the Delta variant. And that's I can maybe later share the reference with you. What is harder to predict is when those variants will emerge and where. What we know from science is there's 1 or 2 theories how can the virus evolve. One of the theories is based that individuals that are immunocompromised, so AIDS or renal transplants, they tend to have longer periods with the virus, and the virus tends to mutate within the individual. And where in the globe where we see the most, probably the most vulnerable population for this to occur is in Africa, where there's a high burden of the population that are immunocompromised through HIV. But that's only a guess where we see the next variant. Maybe that's not the case because nature is very stochastic, and maybe the next variant will appear in Portugal. I don't know. That's
maybe. Well, for that you also need to be checking for them. I wonder how much we are checking for them, or in other countries they check more often. But now to change focus, Luisa, do you think people are more stochastic than viruses? I mean, or is it easier to predict people's behavior?
I think it's not easier. I think it's easier to predict. I agree with Andre. It's easier to predict the virus than human behavior, but especially because the models that we try to use on human behavior are universal. We expect everyone to react in the same way to the same stimuli, and it is not true, because you have to contextualize more the different types of persons, the different interests of the person, and if you do that, you can predict them. You cannot have the same model for a 12-year-old boy and for a 25 years girl, or for an older person. I don't know. You have to, and what COVID has shown is that, for instance, social inequalities are very important and to consider in this case when we are considering data and for instance data in access to health systems and to digital health systems, and to monitorize data with those big data that we assume that people have smartphones or whatever, but not everyone has them. And another thing, so I agree that it's more difficult, but it's more difficult because we use very simple models to model something that is very complex. And the idea of using the same models for everyone does not make sense. If you go to the guys from marketing, they will not use the same strategy to sell a product to different targets, and we try to do that. And so this is my first point. The second point is that I also agree with Andrea and Stefan that we had huge victories in these times of COVID, either in science, technology, or even in healthcare services, that we have advanced in a very, in a few months, we have offered many solutions for many problems. But people themselves, they also have dealt with it in an incredible way, because if there is the COVID situation in the beginning or even now, they have two characteristics that people avoid and hate. It is being uncertainty. So dealing with uncertainty is something that we don't like to do, and a lack of control. So putting the two things together, it is a recipe for fear. And we have, during these almost 2 years, we are dealing with uncertainty, lack of control, and fear every day. And we have done a very good job on that. And this is also a victory, because we have learned a lot in terms of even health literacy. We speak about virus with people that didn't know what the virus was. We speak about ways of transmission, and that is interesting, especially in a country where we have so low levels of literacy, and also health literacy and digital literacy, and it was very impressive. So we dealt with it, creating rules, creating social norms, trusting people and trusting authorities and trusting the system or science. And
Lisa, do you
we did
think
that with enormous, okay.
Yeah, go. Just, I'm just curious to know your opinion on. Do you think, however, that in 2 years' time, in the next flu season, I'm not even talking about the next pandemic, do you think that people will touch the same way in Christmas and in November, in October when the winter comes, or they are going to be a little bit more cautious, maybe recover some masks from the pandemic time and wear them when they go and see an old person or maybe
I hope that we'll be clever in using the good things that pandemic has brought us, because the pandemic has brought us lots of good things. And using a mask, well, that was something that Asian persons did from Japan. They used it to do that. It was strange in airports to see people with masks, and we thought, well, they should have a really bad disease. But it was not. They really used it as a form of respect for the others, because if they have a flu or something, they didn't want to do it to other persons. So I think that we have learned a lot, even in terms of social norms of what is acceptable in the relationship with other persons, and now we have more options. I don't think that we'll not continue to touch each other. I think that we'll continue because we really miss that, all of us, I think.
So I have a question from the audience. Maybe I'll show that to Stefan, and then I really wanna see the slides. So I'm creating some momentum here. But I want to always favor the questions from the audience, and since we have another one, and please, just feel free to send whatever questions. There are no stupid questions, and as you see, we have 3 brilliant minds. They're capable of answering everything, literally everything you can imagine. So just shoot at us questions. And Mariana Shokrala has asked us, what is the relevance of behavioral prediction tools and its data in highly moving and dynamic situations? What do you think, Stefan? You teach data pipelines here in our course, and you've done work on this. What do you think about the relevance of this type of tool?
I think one of the biggest wins of this pandemic is getting health to speak to other entities. Foreign ministry, education ministry, employers, all these different stakeholders provide a lot of important data. Each of them collects data. Something simple, just for example, just one of the biggest wins, I think, in this pandemic was the digital passenger locator form. Why? Because now, all of a sudden, we have created an infrastructure that allows, in the future especially, airlines to share the relevant information through a specific data pipeline using an API. And that is travel data arriving to health, because now we've created a connection. Before it wasn't there. Many countries were still using a piece of paper. Now it's true. Policy has changed this, and has changed in a way because of the Schengen Agreement, for example, in the EU and in other countries. But this has been a true game changer, because the data is traveling from one person to another. And when it comes to behavioral prediction, this is the kind of data that we need to look at. We need to look at data coming from restaurants, for example. We have a treasure trove of data that is easily accessible through, for example, restaurant rating websites, or getting the data about their menu through learning how to access this data and access this in a way that can scale. I think that because people, for example, they buy a certain type of food, and that might help us detect the next gastrointestinal flu outbreak by a certain type of food from a certain type of restaurant. And then you see through connections with electronic medical data and making the link, then you might be able to predict as well how the data moves and even predict people's behavior. For example, it could be that a new restaurant opens or a new joint, food joint opens down the road. All of a sudden, a lot of people are buying this piece of like this special food, and we find out that the special food has a specific infectious disease linked to it. And then we'll see the electronic medical record data changing in real time. And this is because of a simple behavior of eating a specific type of food. But once again, you might have all the best information systems in the world. And I think that it was also another win, because there was a chronic underinvestment in public health. Public health was using information systems that were outdated based on old technologies. And now finally, they're embracing new technologies. And they're bringing new people on board to enable these new technologies. So yes, we can use different behavioral prediction tools, and we might be really surprised, for example, that we haven't negotiated enough, for example, with social networks and the big tech giants to ask for their data. For example, Google was providing mobility reports on a regular basis. What are we doing about that? Why don't we have at least anonymized access to this kind of mobile data, not just depending on a monthly report, for example? These are the kind of questions that we need to ask. And also, as mentioned before, sometimes behavior can be extremely, stochastic. I love this word. I'll be using it a bit more often now. Yeah. And it could be, for example, that you meet someone on the way and you totally change plans. So sometimes even like predicting behavior, like let's say you meet someone, oh, let's go and have 2 drinks. And that place where you go and have drinks might be the place, for example, where there's an infectious disease outbreak. But before, in your plans, let's say we have access to the calendar data of that person. In your plans, you didn't plan to go to the bar. You planned to go back home after work, for example. So I think we really have to have a bit of a balance here in the way we approach things. But at the same time, we need to improve our communication. So we can have the best information systems and we can have the best syndromic surveillance. If we don't know how to communicate the value of the data for public health response, then it will be useless. So if I would invest in something, I would invest in communication. That's for sure.
Thank you. Andrea, I see you want to answer this one as well as, so I give you the floor for this question, but also for sharing us. Andrea has prepared 1 or 2 important information slides. So I want you to maybe start with that, and then you can come back to the question if you need.
If I may, I just want to give a quick reaction to what Stefan was saying. The question from the audience, from Miriam, is a wonderful question that I would really struggle responding in a manageable way. So, and I think Stefan already provided a very good answer. Just a few notes on how governments and how countries structure their information and the impact that has on how we deal and collect data. And I will give two examples, one in Portugal and the other one in Denmark. And Portugal has a wonderful health information system. Part of that is merit of Henrique, which was a person pushing forward the agenda of digitalization of the healthcare system. But both countries have a very good health information system infrastructure. The main difference is the unique identifier that each country uses. For Portugal, the unique identifier that we use in the healthcare system is the national healthcare system number. In Denmark, is the national ID. And the big difference is Denmark is very ready to integrate information from different silos and different ministries. And for example, they can know in a class of 12-year-olds, what's the attack rate of COVID in that specific class, because they are able to integrate the information from the Ministry of Education and the Ministry of Health due to a unique identifier. And many countries, even in Europe, are not yet ready to do this transition because they are still in the process of digitalization of the healthcare. But here we have two examples of two countries with great information systems, and because one has a more siloed approach than the other one, the information they can extract for policy action is quite different. So that was, and I think it's something that we should, in Portugal at least, think of integrating information from different silos of ministries. So now to my slides, very briefly. They are kind of, I created them as thought-provoking, so, and you can interrupt me as soon as you like. This is the first one. It's something that I really struggled with in my position as leader of a small team of 20 people and trying to provide information that was actionable for public decision. And most of the times people and policymakers, they don't really know what they want. They have a vague notion of that they want more information, but it's the experts here have a huge job of finding the right information system, finding the best quality data, providing the best analysis and the best data visualization so that the public health stakeholders and people engaged in public policy can be informed about that information and then leverage that information to improve public policy. What we see very often is people saying vague things that we need more data, and in fact the data is there. So that was one of my key lessons. It's to have the best talented people trying to improve health information systems, trying to improve data analysis pipelines to provide the best expert input. And we have seen through this pandemic a lot of demise of experts. But we also have seen some new fields arriving to epidemiology and things that are very relevant. I don't mean to say that we don't have to listen to our customer, but there's a very important input from the expert field. This is my second slide, and it's kind of a joke that I found on Twitter and relaying to something that Enrique said in the beginning. If you want to find me on Twitter and not on LinkedIn. I'm not so active on LinkedIn, but if you find me on Twitter and send me in a message, my profile is open and I'll be very happy to engage with you and respond. And this slide kind of highlights how the modern digital infrastructure is built, and it's very complex. And some of the infrastructure has a legacy problem. And for example, in the epidemiological surveillance system was built many years ago. Probably it was state of the art back then, but the technologies, they need a constant investment towards modernization, and even then sometimes they have legacy problems. What I found as well, and it's not a very positive thing, when people find something that doesn't work, the initial impulse is to create a new system. And we must urge people not to create new systems, to improve what we have, especially when we are dealing with critical infrastructure. For example, the epidemiological surveillance system all across Europe are now critical infrastructures. We cannot have a week to replace an old system with a new system and be completely blind with no information about how the disease is progressing. So we have to be very careful in investing and modernizing this digital infrastructure. not only in the times of crisis, but especially when there is not a crisis. And that's kind of a big lesson from here. And Portugal gains a lot from this previous investment in digital infrastructure. For example, having modernized the vaccine infrastructure and being all digital was fundamental to know how many people we had already vaccinated and who was not vaccinated, and to tackle policy responses specifically to tackle those who were not vaccinated. And
you have 2 minutes, Andrea.
And this is my last slide, and I already covered this. With this slide, I wanted to talk about the digital contact tracing and the technology that it's a good idea, but not ripe yet. And there's a lot of leakage in these pipes. And I think for the next 10 years, our work is to work on those leakage and to create better digital contact tracing technology. And that's all that I had to share. Thank you.
I think that was super good, because I think you made sure that we wrap up on these topics. Thank you for the compliment at some point that you made. We have a bunch of questions from the audience, so let's grab them immediately, as we still have about 5 minutes. So Luis Lino asks, would it be possible and beneficial to manage and respond to a pandemic or a new pandemic on a European level with more integrated digital health tools and data on a more centralized way? And then I'm just reading both of them. And then Clayton asks, for Andrea, part of what we have observed during the current pandemic is that there is still a reluctance on behalf of some healthcare professionals and policy makers to embrace the technology available. How can we change this situation, and what can we do to break down barriers even within the health systems? So maybe I'll before going into this. A question to Luisa. Do you think that these topics we were just mentioning about, preparing the data and that these systems are not perfect? I mean, I really like this picture that Andrea had with the system designed by someone from Nebraska. Do you think the human element of information systems, and not IT information systems, but the way we organize information in societies, do you think that we have been so seduced by technology that perhaps we have upgraded the servers, upgraded the software, but maybe not upgraded the way people work together, they synchronize, how do you see that the human element of the information systems?
I see two things. The first thing is that many of the technological developments that are done to be used by persons are done only by technologists, and they do not co-create it with the end users. And so that is the main flaw. We had that issue in Portugal with a very good technology to trace COVID transmission, but that it was not done with the persons, and it was not compatible with the systems that persons used. And so it was a very good technology, but it was not used in the end. The second thing is that I believe that all this crisis and this huge boom of digital health made also people be aware of what can be done at distance, virtually, and what has to be done face to face, and that we are much more interdependent of the others also in using digital technologies. And so we became, I think that we became aware of some things that we were not so clear before, like also the need of new skills in professionals and also in patients. And I don't speak only of literal digital literacy, but also dealing with uncertainty, teamwork, and I don't know, tolerance to mistakes, things that we have to do with each other when we are not in presence, but we have to deal with it and to increase these soft skills and not only the technological skills. I think that this was also something that we became aware during this pandemic and during this boom of digital health.
Thank you. Stefan, can you in 1 minute address the question of Luis in terms of the European level usage?
So I think there's a lot of work. I think there was a whole STOA study just on European level, just on this, on developing the European health data space, and even looking at creating the first EU virtual agency, which is focused on health data. So there is already an answer to that, actually, in just the work that has been done in the past year. So that will solve a lot of issues, just even by creating and directing people to take the right decision. And if I had to kind of summarize this, I would say that the next big action that needs to be taken is that every Ministry for Health and every public health organization needs to have a chief data officer tomorrow, or even better, yesterday. They need to have this person. They need to have that team even, and a relevant project management. So it's useless, having the best information systems, but not having the people who communicate and deliver all of these. And it doesn't have to be a doctor or a medical professional. It could be someone who has expertise in communication and making sure they deliver the items, the deliverables on time, even data deliverables, including reports, analytics, intelligence, all of these. And that's really and truly the way forward. Communicating chief data officers across different organizations, as we saw in CDC, for example, and a vision, a strategy and vision, which is led by a European agency, for example, and driven by it. Over. Thanks.
You, Andrea, what do you think about the resistance or the siloing and some resistance from professionals regarding existing technologies? Do you think that is a fair question?
That's a wonderful.
How can we break down the barriers?
That's a wonderful question, and I felt that on my skin several times during these last 2 years. A few thoughts. So on the higher level, I think on the director level and even above, what we need, it's a little bit change of mind, and it's not a judgmental. I'm not saying this on a judgmental way, but whenever you thrive for innovation, innovation also means failure. And that's something that from a public administration perspective, it's not very well regarded. That sometimes to innovate, you need to fail once, and then the second version will be the one that fully scale up. That's one topic. Another topic, and I think right now, and it's very worrisome for me, there's a huge gap of knowledge between private sector and public health sector. And the public health sector, it's really difficult to get some the best data people to work for the public health sector, because the policies are not in place to make this attractive for the most bright minds. In terms of management of change and technology adoption, there's a lot to be done here. And to have a new information system doesn't mean that people will use it. And we have seen that even in the deployment of some new software in Portugal, like Trace COVID. If it doesn't really facilitate the way that healthcare professionals at the local level operate, probably will not be adopted. Even if it gathers the most fantastic data, if it doesn't make life easier, it will not be adopted. And in this scale up, we really need to engage and listen to healthcare professionals to make for the version 3.0 to be better and facilitate people. And Henrique I'm not pulling your leg, but you are the expert here in management of change and adoption of new technologies.
Well, for that, and thank you for the wonderful responses to our audience. Since we have only 2 minutes to wrap up, and then linking to that, I think it's we need to build an army of people ready to help, and in order to do that, you know, we just invite everyone to. So we've had this wonderful masterclass. Invite you to the program. You have more information online on the program. I'm going to change to Portuguese now to finish the session and invite all Portuguese that have been listening to us and others that understand Portuguese. Stefan already talks a little bit of Portuguese. Convido-vos a preencherem a vossa inscrição, a submeterem a vossa candidatura para este curso. O curso é, de facto, um curso com muitas das discussões que estivemos aqui a ter em pequeno detalhe, mas em muito pormenor, e, portanto, aprofundado, desde as questões dos sistemas de informação à mudança das pessoas e dos comportamentos, e é por isso um curso que eu acho que ajuda a criar esta massa de pessoas que vão ser precisas para realmente preparar a sociedade portuguesa e a sociedade em geral para uma saúde mais digital. E com isto, agradecer aos meus parceiros de conversa, agradecer a todos os que nos estiveram a ouvir em Portugal, fora de Portugal, à distância, e desejar a todos um bom início de 2022, porque estamos a começar. Nós vamos ter mais sessões em Fevereiro, em Março e em Abril. O programa começa no dia 20 de maio, mas há apoio às primeiras 10 pessoas que se inscreverem podem beneficiar de uma bolsa de desconto, que é patrocinada pela Lind, pelo 2º ano consecutivo, e portanto gostava também de agradecer à Lind esse apoio. Thank you very much, Stefan, for your participation. Thank you all the non-Portuguese speaking members that have been joining us throughout the world and sending some questions. And this will be recorded and available. Thank you very much for joining us, and have a nice, wonderful evening and a nice weekend. Thank you very much.